On this, we're now joined by Dr. Andrew Ball from the HIV/AIDS Department at the World Health Organization. Dr. Ball, many thanks for joining us. Now, as we were hearing in our report there is a growing voice among the scientific community that challenges the conventional view that only HIV causes AIDS, but they feel that they're being ignored by the rest of the scientific world. Isn't science all about asking questions?
It certainly is, and this question has been asked many times, and I think that without doubt we have very clear evidence that HIV is the cause of AIDS. This is an old issue. It's an issue that has been dealt with. Of course, science has to be open to any new evidence, but as far as we're concerned, there certainly isn't any new evidence to demonstrate anything otherwise. Well,
Dr. Ball, if I can just interrupt you there. You say that this is an old issue and that it's been dealt with. In what way has it been dealt with? Has any clarification on the issue of whether HIV is the only cause of AIDS been reached?
Well, definitely. I think certainly from the 1990s, when HIV was first discovered, that the evidence is very clear that that is the cause, that the HIV virus does cause deterioration in the immune system, and that results in the disease that we know as AIDS.
Well, those among the scientific community that disagree with you, that argue that there are other causes to the AIDS virus apart from HIV, suggest that possibly the issue of billions of dollars being at stake in the treatment of HIV/AIDS that's making mainstream science, that's the issue that's making mainstream science reject any questioning of the received wisdom.
I don't see that as being an argument at all. The virus was discovered before effective treatment was available and before we saw the very significant treatment scale-up that we see today. In reality, we're seeing that treatment is saving millions of lives, and any questioning of that is a major concern.
But since the discovery of the disease some 3 decades ago, during the 1980s, we do know that some 25 million people have died as a result. And of course, it has become a multi-billion-dollar industry among the drugs industry. So do you not think that that could potentially pose some obstacle to alternative theories coming to the fore within the scientific community on this issue?
Not at all. It's a very complicated illness. It's a very complicated virus. It is one of the most difficult infectious diseases that we've ever had to deal with. And this has meant an incredible amount of investment in new technologies, new medicines, new approaches to treatment, which have not only benefited those individuals who are infected with HIV, but a much broader community. It has resulted in a huge amount of research into basic sciences, into virology, into medicines, into mobilising communities that are marginalised and at risk of a whole range of other health problems. And this whole movement, this mobilisation of the scientific community, the community of people living with HIV, those populations most vulnerable, are having a very significant impact on a much broader range of health issues.
But Dr. Ball, you say that the link has been established between HIV and AIDS. You say that a considerable amount of money has been invested into treatments. But the net result is that we still don't know how to cure the disease, how to cure AIDS. So how close are we really, and what's being done to reach ever closer to that cure?
Well, currently we have some very effective treatments. Before, in the 1980s, up through to the middle of the 1990s, really HIV infection was a death sentence. There was nothing, no effective treatment available until the mid-1990s. At that time, combination therapy was introduced, and we saw a dramatic decline in the actual rates of death among people living with HIV. So now we're looking at an infection and a disease which is now a chronic disease, where we can expect people to live for many years as long as they have access to good quality treatment and care.
And yet the cure still eludes the scientific community. And are you saying, on behalf of the World Health Organization, that you are not open to considering alternative theories, that HIV is not the only cause of AIDS?
We're open to the science, and certainly the processes that WHO undertakes requires very rigorous review of the science, and not just from a few individuals. It requires input from a broad range of sectors, from basic scientists through to people living with HIV, through to the manufacturers of medicines, through to public health officials in countries, particularly those most affected. So we're able to monitor really what is going on there very broadly.
OK, Dr. Andrew Ball, many thanks for those thoughts. I'm afraid we're going to have to leave it there. That was Dr. Ball, Senior Strategy and Operations Advisor of the HIV/AIDS Department at the World Health Organization.